Our patient today came to us because she would love to improve the skin quality on her face. We can see there is some sun damage, some increased pore size, and a little bit of dehydration. So I have chosen Newest as our first session, first treatment for this patient. Why Newest? Newest has a combination of polynucleotides HPT, hyaluronic acid, and mannitol, which is going to prolong the life of the non-cross-link AJ that we have in the product. So I'm going to start by injecting under the jawline. I think this is an area that we underestimate, and we should really be treating this area a little bit more often than we normally do. So when your patients come in and ask for treatments on the neck, they often will complain about the middle section. But we need to understand that we also need to treat the skin, other side of where the problem is lying. So as you can see here, I'm going really under the chin and create some boluses in this area. Now, like I said, we're using a combination of hyaluronic acid and non-cross-link and polynucleotides. And this will be true for my first session. Having said that, whenever my patient returns for the second session or third session or even fourth session, I might consider using something a little bit stronger. I might consider using Plinest. So you can either treat your patients with 3 to 4 sessions of Newest, the combination of hyaluronic acid and polynucleotides HPT, or you could combine the use of Newest as well as Plinest. I love to talk about Newest because I find that this product has 2 wonders. Not only we know from the studies that the combination of polynucleotides HPT and hyaluronic acid improves the collagen stimulation type 1 and type 3, but it gives hope to the patient. Why do I say this? I say hope because, as we all know, hyaluronic acid has the ability to create this glow in the skin. And when the patients come and see you for any regenerative aesthetic treatments, they will not see a result for at least 3 months. So by giving them a little bit of hydration with the hyaluronic acid within Newest, you are giving them a little bit of hope that something is happening. So I find that for my patients, starting with Newest, it's a good combination for them to be more complacent with their treatment, with their course of treatment, either 3 or 4 treatments, like I said before. How are we doing? Fantastic. So you can see a little bit trickier to inject under the chin. And I'm using again the 4 millimeter needles, 33 gauge. I find this gives me less bruising to my patients, and it makes the treatment a little bit more comfortable. When it comes to aftercare, we'll do exactly the same like any other polynucleotide treatments or any injectable treatment. We want the skin to be clear of any makeup, creams, anything that could potentially contaminate the skin with bacteria, with saunas, swimming pools. And you always want to ask your patients to avoid any sun damage. So Newest has a hydration product, is brilliant, but also, just gonna turn a little bit more to me, thank you. But we have the regeneration of the polynucleotides HPT. So if your patient suffers from rosacea, for example, in the neck, which we see a lot with our menopausal patients, this will be also a great product. As we know, during menopause, our skin produces less hyaluronic acid and is often more inflamed. So this is a great product to use for those menopausal patients. We're nearly finished. So in total, I'm going to be using 2 ml of Newest. Just going to go under the chin a little bit more. And you can see always raising blebs. This is how you know you are in the dermis. Well done. So we're going to start by injecting Newest and raising a little bleb to make sure we are in the dermis. So why did I choose this product in particular for this case? So the patient was showing signs of pigmentation, some signs of inflammation, as well as increased pore size. I also noticed some dehydration within the skin. So when we're talking about Newest, we are not only getting the magic of the polynucleotides, and we're getting improvement on the stimulation of the viability of our fibroblasts. We're going to have cell proliferation, and therefore, because we are stimulating the fibroblasts, we are going to improve collagen type 1, collagen type 3, elastin, and as well our own hyaluronic acid. And that's why it's important to explain to your patients that unfortunately all of this, it won't happen very quickly. Although we know from the studies that from 96 days after reinjecting the product, you start seeing some results, but this only happens on a cellular level. Whenever it comes to visible results for your patients, they probably gonna wait, I would say probably 12 weeks before they see the full outcomes from the treatment. So this treatment should be performed every 3 to 4 weeks, and 3 to 4 treatments as a course of treatment. That's when you're going to see great results from it. If you don't stimulate the skin enough, you're not going to be able to achieve results. So managing your patient expectations and how much product you're going to use is going to have a direct impact on the outcome of your patients. So the midline is the area that your patient will feel a little bit more discomfort. And this is the area that you're going to see a little bit more bleeding happening. And that's normal. Like I said to you, in the midline, this patient in particular has a little bit more inflammation. So this will be so true for your rosacea patients as well. So we're going to be using 1 ml per side. So you could potentially do this treatment as well with a cannula. And the benefit that you'll have by using a cannula is you'll probably have a little bit less downtime for your patients and definitely less chance of bruising. I always find that if I want to cover a full face treatment, that 2 ml of Newest is not enough. So I'm pretty much nearly done with my 1 ml, but as you can see, I could have another syringe in order to get even more stimulation, because I feel that I'm going to be a little bit short if I wanted to do the whole face, including forehead, upper lip, lines and all that. So my recommendation is always to have 4 ml instead of 2 if we're doing the full face. Nearly finished. Well done. So we're going to improve the inflammation as well as pigmentation and skin tightness. So this area that I'm injecting now, it's probably the most sensitive area for your patients. So make sure they are aware that you're going to be injecting the product in this area so they can count off on the discomfort that they're going to have. The other thing that I haven't mentioned is your patients are very used to hearing about skin boosters, but maybe not so much about polynucleotides, HPT. And when they come to your clinic asking for skin boosters. Maybe this is a good opportunity to explain about the regeneration products and the rejuvenation that you can get with polynucleotides HPT. So if you have someone that doesn't want to give up on their amazing skin booster because they love the glow that they have with a product, NEWEST, it's going to be the best of both worlds. You're going to have the regeneration from the polynucleotides HPT, but you're also going to have the glow that you get with your skin boosters. Besides that, you have your mannitol that is also included on the product that is going to prolong the life of the hyaluronic acid within the product, so that glow will last a little bit longer. So something came up from the studies that is quite interesting. When you combine polynucleotides HPT and hyaluronic acid, we actually see an improvement on the cell proliferation and more stimulation of collagen type 1 and collagen type 3. So this is an encouraging side for us. When we are injecting NEWEST, we know our patient is going to get the best treatment. So either if it's for prevention or for rejuvenation, NEWEST is one of the best treatments that your patients can have when we're talking about giving a little bit of hydration immediately, as well as regeneration from the polynucleotides HPT. So then they don't feel that they have to choose between skin boosters or polynucleotides HPT. They can have the best of both worlds. I'm just finishing now with the chin. So just as a summary, so where or when will I choose NEWEST? I can choose NEWEST for everywhere I want in the face, with the exception of the eye area. I can use on the neck, I can use it on the décolletage. And I often use this product as the first treatment that my patients have. This is a great product as well for the perioral area, for patients that start developing these early fine lines around the mouth. Well done, we're nearly finished. Well done. With our lovely patient Azam, we had neck and face treatments with NEWEST. NEWEST, a combination of polynucleotides HPT, hyaluronic acid, non-cross-linked 10 milligrams, and mannitol. The protocol for both neck and face will be 3 sessions, 3 to 4 weeks apart. In the face, I would probably want her to come back for a 4th session because there were more pigmentation, more increased pore sizes, and more fine lines and wrinkles.